Good day, I'm Yvonne from section N15, and now I'm going to demonstrate the assessing the skull and face, eye structures and visual acuity, ears and hearing, nose and sinuses, mouth and oropharynx, and neck. So the basic concept of assessing the skull and face is an inspection and palpation of the skull and face, and also measuring the skull circumference, in which the presence of deviation and changes of the facial shape may indicate a disorder or certain condition. And assessing the eye structures and visual acuity is an examination of the eye that includes the external eye structure, visual perceptions, ocular movement, and visual fields. Assessment of vision provides important information about clients' ability to interact with the environment and perform activities of the daily living. And for assessing the ears and hearing, it is an examination of the ear structures and determination of the client's hearing acuity, which consists of direct inspection, palpation of the ear, and technique to assess auditory acuity and sound conduction. And for assessing the nose and sinuses, is an inspection and palpation of the external nose structures and sinuses, and inspection of patency of the nasal cavities. And assessing the mouth and oropharynx is an inspection of the structures associated with eating and taste, with composed of the lips, buccal mucosa, tongue, floor of the mouth, teeth, gums, hard and soft palate, uvula, salivary gland, tonsillar pillars, and tonsils. And for assessing the neck, it is an examination of the neck muscles, lymph nodes, trachea, thyroid glands, carotid arteries, and jugular veins. For the objective is to check for any deviation of the skull and face, eye structure and visual acuity, hearing, ear and hearing, nose and sinuses, mouth and oropharynx and neck, and to acquire information and accurate nursing history of the eyes and vision, ears and hearing, nasal, oral, and neck of the client. To be able to formulate nursing diagnosis, collaborative problem, and referral. And for the preparation is you need to introduce yourself and verify the client's identity. You need to explain to the client that what you are going to do and why is it necessary and how the client can cooperate. Then you need to perform hand hygiene and observe appropriate infection controls, procedures, and then lastly, provide for client's privacy. So the first procedure is to inquire the client has any history of lumps or bumps, itching, scaling, or dandruff, loss of consciousness, dizziness, seizures, headache, facial pain, or injury. If so, when and how any lumps occurred, length of time any other problem existed, any known cause of any problem, associated symptoms, treatment, and recurrence. Now, let us inspect the skull for size, shape, and symmetry. But before that, you should wear gloves to prevent acquired infection. But since then I don't have any gloves, let's just assume that I am wearing one. After, measure the size of the head using a tape measure. So let's just assume that this is a tape measure and we're going to measure the size of the head. Then inspect for the size and the circumference of the head. After, we're going to palpate the skull for any presence of nodule masses or depression. And take note that only use your fingertips and gently perform it using rotation motion. Start from the front, palpate towards to the midline and each side of the head. After, we're going to palpate the skull for any presence of nodule masses or depression. And take note that only use your fingertips and gently perform it using a rotational motion. Then start from the front palpate downward to the midline and each side of the head. So if your client have eyeglasses, you should remove it. We also need to inspect for the features of the face and inspect the eye for the presence of edema or hollowness. Take note also for the facial movement of the client. Ask the client to evaluate the eyebrows from lower eyebrows, closed eyes, tightly puffed cheeks, and smile and show teeth. After documenting, we will now proceed in assessing the external structures of the eye. First is you need to inspect the eyebrows of the distribution of hair, alignment, and skin quality and movement. Then, assess also for the evenness and distribution of the eyelashes, eyelid surface, and its characteristic position and ability of the client to blink and the frequency of the blink. And inspect the lower leg of the client's eye when it's closed. We would then proceed in inspecting for the lacrimal gland and the sac, then observe for edema between the lower leg of the nose and observe for evidence and increased steering. Use only the tip of your fingers and palpate inside the orbital rim near the inner canthus. Palpate it gently and note for the evidence of increased tearing. After, we would now assess for the corneal clarity and texture. Ask the client to look straight ahead, hold a pen light, and an oblique angle to the eye, and move the light slowly across the corneal surface. Make it sure that the light should not directly be in the patient to prevent any form of cephalgia. Then, note also for the possible findings that you may encounter during assessing the corneal for clarity, the tearing, and the redness if the patient will complain of extreme sensitivity to light. Now we're going to be performing the corneal sensitivity test to determine the function of the fifth cranial nerve. Now, inspect the pupil for color shape and symmetry of size. Then assess each pupil's direct and consensual reaction to the light in a particularly darkened room. Then ask the client to look straight ahead using a pen light and approaching from the side, shine a light on the pupil. Then, assess each pupil's reaction to accommodation. Hold an object about 10 cm from the patient's nose. And then ask the client to look at the top of the object and then at the distal object behind the pen light. Then, alternate the gaze between the near and far object. Observe the pupil response. Next is to move the pen light or pencil towards the client's nose. Then the pupils should converge. To record normal assessment of the pupil's pupil, use the abbreviation of PERLA. Then for assessing the peripheral vision fields, have the client sit directly facing you at a distance of 60 to 90 cm. Then ask the client to cover his eye with the card and look directly at your nose. Then hold an object in your fingers and extend your arm and move the object into the visual field from various points in the periphery. Other side. Then ask the client to tell you when the moving object is first spotted. To test the temporal field of the left eye, extend and move your right arm and from the client's right periphery. And to test the upward field of the left eye, extend and move the right arm down to from the upward periphery. Then to test the downward field of the left eye, extend and move the right arm up from the lower periphery. Then test the nasal field of the left eye, extend and move your left arm in from the periphery. Then repeat above the step of the right eye. For the extraocular muscle test, assess 6 ocular movement to determine eye alignment and coordination. Stand directly in front of the client and hold the pen light at a comfortable distance such as 30 centimeters in front of the client's eye. Then ask the client to hold the head in a fixed position facing you and follow the movement of the pen light with the eyes only. Then move the pen light in a slow, orderly manner through the 6 cardinal fields of gaze. Then stop the movement of the pen light periodically so that the nystagmus can be detected. Then we're going to assess for location of the light reflex by shining a pen light in the pupil and corneal surface. Have the client fixate on a near or far object, then cover one eye and observe for the movement in the uncovered eye. Sir, can you cover your one eye? Other side. Then let's move on assessing the near vision by providing the adequate lighting and asking the client to read from a magazine or newspaper. Then let's assume that the client has already done reading a magazine or a newspaper. Then let's proceed in assessing the distance vision by asking the client to wear corrective lenses unless they are used for reading only. We'll now proceed in assessing the ears and hearing, and let's inspect for the position of the level with disappear aspects of the auricles that is attached to the head with relation to the eyes of the client. We're going to palpate after inspecting the articles of the strike textures, elasticity, and areas of tenderness by gently pulling the auricles upward and downward manner and backward. Then fold the pinna forward, then it should recoil. Then we're going to push the tragus and apply a pressure, the mastoid process. Then for the external ear canal and tympanic membrane, before inspecting for the ear canal and tympanic membrane, do wear gloves. And now, in inspecting the client's head should be away from the examiner. The examiner should hold the otoscope either right side up with fingers between the otoscope and insert it gently to the ear canal by avoiding pressure of the spare column and side of the ear canal. So let's just assume that this is an otoscope. Then we're going to Then for the gross hearing acuity test, I'm going to assess the client's response to in a normal tone if the client has difficulty in hearing. A normal voice, proceed with the watch tape test. Then have the client occlude one ear. Out of the client's side, place a ticking watch 2 to 3 centimeters from the occluded ear. Then ask what the client can hear. Then we'll perform the Weber's test by holding a tuning fork. Let's just assume that this is a tuning fork. Activate by tapping the fork gently against the back of the hand and near the knuckles by stroking the fork between the thumb and index finger. Then we would place the base of the vibrating fork on the top of the patient's head. And now we would ask the patient if he's able to hear the noise. We would not proceed in performing the range test so that the client will block the hearing in one ear intermittently by moving our fingertips and out of the ear canal. As you can see, I'm now performing the Weber's test. As you can see, I'm still performing the Weber's test, and I'm going to activate now the tuning fork to perform the range test. So after activating your tuning fork, place it in the mastering process in one ear until the client state that the vibration can no longer be heard. And we would also place the vibrating fork in front of the client's ears, so remove any accessories that hinders in the ears of the patient. And for assessing the nose and sinuses, now for assessing the nose and sinuses, we're going to use our speculum and our pen light. First, we're going to be conducting the health history. This includes allergies, difficulty of breathing, inspection to the nose and face, any nosebleed, any medication taken, and we will position our patient comfortably. Now, in assessing for the nose, inspect the external nose for any deviation, nasal, flaring. In assessing for the nose, inspect the external nose for any deviation, nasal, flaring, its size, the color, and any presence of discharge. And I'm going to be using our pen light for determining the discharge. Then, lightly palpate the external for any masses or displacement of the bone and cartilage. Now we're going to be assessing the patency by asking the client to close the mouth and exert pressure to the nostril and repeat the process on the same nostril. Now, when assessing for the nasal cavity, we're going to be using our pen light. Then we would inspect for the nasal septum, any deviation of any presence of discharge, redness, and swelling. Then we'll position the head lightly tilted and determine any presence of obstruction. Then we're going to be placing now our nasal septum gently. So that nasal should be placed gently to prevent any pressure on the nasal speculum. And then we will hold the hand position, then hold the light accordingly for the guidance and for determining any pressure. Then we will also inspect the integrity of the position of the nasal speculum on each of the nostril. Then we would allow the patient to take a quick rest to avoid of the pressure of the nostril will be prevented. Then take note that the nasal speculum should be about 1 centimeter or up to the point which the blade widen, and will also determine for any redness, swelling, and abnormalities in appearance of the nostril. Now we're going to be assessing the facial sinuses. You can use your index finger and palpating the maxillary and frontal for any tenderness. Now, when assessing the mouth and oropharynx, we're going to inspect the lips and buccal mucosa. Then we're going to inspect the outer lips, symmetry, contour, color, and texture. We can use the pen light and ask the client to purse the lips as if the client is going to whistle. We would inspect and palpate for inner lips mucosa with the color and moisture. Then for the teeth and gums, while examining the inner lip and buccal mucosa, we'll ask the client to remove the dentures if there's any. Then note the condition of the denture. Then for the tongue and floor mouth, inspect the tongue for the color and ask the client to protrude the tongue and move it from side to side. And you stick your tongue out. Move it side to side. Then we're going to inspect the movement by letting the client to roll the tongue upward and move it from side to side. Upward. Then side to side. Now, in inspecting for the base of the tongue, we're going to inspect for the mouth, floor, and the frenulum. Then palpate the floor of the tongue using a piece of gauze and palpate for any nodules and lumps if there's any. Then, for the salivary glands, to inspect the salivary glands, let the client open his mouth and inspect if there's any redness and swelling. Can you open your mouth? And for the palate and uvula, Inspect for inspect inspect for any color, shape, texture, and the presence of any bony prominence. Then ask the client to open the mouth widely and tilt the head backward. Then use the tongue, the presser. Then use the pen light for visualization. Then we will inspect the position of the uvula, the mobility while examining the palates, and observe the uvula by letting the client say ah so that the soft palate will rise. Then, for the oropharynx and tonsils, take note for the color and texture. Then we would also inspect one side at a time and to expose one side of the oropharynx by pressuring the tongue blade and use the pen light for lighting. Then inspect also for the color and size of the tonsils. Then we would, then we would elicit gag reflex by pressing the posterior aspect of the tongue. And now for assessing the neck. In assessing the neck, we should inquire if the client has any history of problems with neck lumps, neck pain, or stiffness. Then when and how lumps occurred, any diagnosis of thyroid problems, any treatment such as surgery or radiation. And now we're going to inspect the neck muscles. Then by asking the client to move the chin, chest, then move the head back on the chin and point it out downward and upward. Downward. Upward. Then move the head so that the ear is moved towards shoulders each side and turn the head to the right and the head to the left. Then ask the client also for the muscle strength and turning the head from one side to another with resistance of the hand and repeat to other side. Then shrug the shoulder against with the resistance of your hand. You should do like this. Follow me. Then place the hand to the shoulder and allow the client to shrug against resistance. Then for the lymph nodes, we're going to palpate the entire neck for enlargement of the lymph nodes. Then for the trachea, we're going to palpating the trachea for lateral elevation using your thumb. Place your fingertip or thumb on the trachea and the suprasternal. Then move your finger lateral to the left and right in spaces borders by the clavicle. Then the anterior aspects of the sternocleidomastoid. Then the anterior aspects of the sternocleidomastoid muscles in the trachea. Yes. Then for the thyroid gland, in inspecting for thyroid gland, we would stand in front of the client and observe the lower half of the neck overlying the thyroid glands for asymmetry and visible masses. Then ask the client to hyperextend the head and swallow. If necessary, offer a glass of water and to make it easier for the client to swallow. Then, palpate the thyroid gland to smoothness. Note any area of enlargement, masses or nodules. Then, if enlargement of the gland is suspected, you should oscillate over the thyroid area for a root sound. Then, use a bell-shaped diaphragm of the stethoscope. Then lastly, document the findings in the client's record. That will be all. Thank you.